All right, class. Today, I'm going to teach you about the Book of Muscles. It's a nice book written by me. You can see it's a little diagram there. I'm not very good at drawing, but it's a diagram of the skull with the main parts about the head, really. This is the table of contents. The first part's going to be about the face, neck, and muscles. You can read it there. Second part, the front of the trunk, back of the trunk, front of the leg, and the back of the leg. Labeled picture. Now this is the skull, or the face, head, neck. These are all the main parts of the skull, the neck, and all the muscles that come together to help you move and help you move your head, neck, and do a lot of functions in your neck. You have the masseter, you have the zygomacus, you have the frontalis, the cranial penosis, just to name a few. Muscle functions right here. It's about 10 muscle functions. You got the temporalis, it's one of the 7 muscles that's responsible for chewing. The frontal, the frontalis, the muscle responsible for elevating your eyebrows. The osteoplatus, the main function is responsible for making the scalp move back. And then you have the platysma, which is responsible for producing a wide array of facial expressions, smiling, frowning, all those. And you got the orbicularis oculi, which is it allows you to close your lips. The zygomaticus allows you to smile, and you can read the rest of them, right? These are just the basic muscle functions of each of the muscles that are going on mainly in your face. Turn the page. And then we have a rare disorder. This disorder is called hyperptosis frontalis, and it's essentially it's a very rare disorder, but the main characteristic of this is the thickening of the frontal bone of the skull. Now, mainly it affects about 12% of the female population, and other aforementioned symptoms that patients experience other than the symptoms of the thickening frontal lobe, some discomfort, some pain, all that jazz. It seems to be hereditary. It's passed down from generation to generation. It's classified as a very, very rare disease, but it does have a high survival rate, but currently there are no treatments available. The front of the trunk label. This is your front body. Your chest, down to your stomach, all of it, right then and there. Then you have your chest. It has the deltoids, the pectoral muscles, the biceps, the interoblique, and then the pectum abdominis. Those are just to name a few. The muscle functions. You have the deltoids. Main function is being the abductor of the arm. If you're a bodybuilder, the deltoid is something you want to flex off. If you're in a bodybuilding competition. And you also have the pectoralis major. It helps with the adduction and rotation of your arm. Biceps allows for a bicep flexion on your elbow. Bicep also very important in, for example, bodybuilding. You want to be strong, have good biceps. Then you have the rectus abdominis, which helps you extend and raise the knee. Of course, you need that to walk. And just a few other ones that are very essential with your body, the front of your body, helping it move all the muscles and everything. Now, a rare disorder you have is called deltoid fibrosis. Now, it's a sort of a rare disorder that it affects the deltoid muscle. Its main symptoms are the development of fibrous bands on the deltoid muscle. Now, it's seen in people of all ages, but, coincidentally, it's most common in children. It's a very rare disorder in the U.S., but it's seen more common in Asia. Some other symptoms are difficulty with the movement of the shoulder and an inability to fully extend the arm, pull the arm down, It's usually diagnosed by an x-ray, and the only viable treatment is surgery. Here's the back of the trunk. I believe this is your back. You still have your deltoids, your triceps, your latissimus dorsi. Those are the 4. Your deltoids, already explained it. Your trapezius, those are another muscle. Your traps right near your neck, right along your neck, connecting to the spine. Now, its main function. Sorry if it gets blurry there, class. Its main function, it's helps stabilize and move your scalp. Tricep brachia. These are your tricep muscles. Tricep muscles basically on the opposite side of the bicep. It's example, also important for bodybuilding to have good detailed biceps, or triceps, I'm sorry. Then you have the latimus dorsi, which is the main function to abduct and rotate the arm. Very important for moving your arm, all that jazz. Yeah, but rare disorder, Trapeze muscle palsy. That's the disorder I chose. It's it's a very rare disorder that affects the trap muscle. It damages the nerves that connects your trapezius muscle, to the other parts of the body, which cause it to be weak and waste away. The two main causes are trauma to the neck and a jerking injury of the neck. Some treatment. The two main treatments are medication and surgery. My little mother. Here's the back of the leg labeled. Back of the leg, labeled. And these are the muscle functions here. Those are all the muscle functions there. You have the gluteus maximus, gluteus medius, which allows for hip stabilization. Then you got the gluteus maximus, which helps extend the hip. Abductor muscles abducts thighs at the hip joint. Bicep femoris helps perform knee extensions. The semimembran essos helps extend hip joints. Just the rest. All right, class, that's basically all for today. These are the book of muscles. Now, these are the muscles in your face, in your neck, your back, the front of your body, your legs. These muscles are very important for you, and they're just essential to helping you move, helping you do a lot of day-to-day activities. All right, class, that's enough for today, and we'll see you guys next week.